Antidepressant agents. That's our topic for today. Depression is the most common affective disorder. Affective disorder is a disorder that majorly affects someone's mood, not their thoughts, not their ability to recognize or separate one individual from another. No, but it actually affects someone's mood. It can range from something that is mild to very severe. So it can range from a mild condition to a very severe condition. In fact, it has been estimated that over 10% of people have been depressed at one point or the other in their life. And some amount of people who commit suicide have been due to depression. The symptoms that you are going to see for depression can be grouped into two. We have the emotional symptoms and we have the biological symptoms. For emotional symptoms, it is with the person feeling that he or she is ugly, the person always looking at the bad aspect of life, the person always showing that I don't have interest in this, I don't have interest in that, just showing some apathy. The person look down himself. Those are emotional symptoms. But biological symptoms are the symptoms that actually have to affect the person's way of living. The person no longer is interested in having sex. The person is no longer interested in eating food, loss of appetite. The person also is no longer interested in sleeping. The person have disturbance in sleep. The person can stay all through without sleeping. There can be a little bit retardedness of thoughts when it gets to biological. All right, so biological is kind of worse than emotional because it affects the person's way of living. It can affect their appearance. The person don't eat, the person reduces in size, loss of libido can actually make a home goes crazy. So you can see biological symptoms are kind of serious. Now let's classify depression. Depression can be classified based on how it originates. Where is it coming from? Based on its origin, depression is classified into two. One, we have what we refer to as reactive depression. This is a condition where somebody is reacting, is responding to something that has happened. Let's say, for example, a woman lost her husband. She fall into depression because she's reacting to actually a real stimuli. Do you get now? Somebody is seriously ill and fall into depression. These are reactive or secondary depression. Then, in some other conditions, depression can be due to endogenous, like the hormones of an individual is being altered. Do you get now? The hormones are supposed to be making the person happy that his body produce normally. Its production or a degradation is being altered. That's endogenous depression. It is genetically determined. Endogenous depression. Hmm, that is endogenous. In endogenous depression, the person has inability to experience pleasure, or to cope with even ordinary activities of life. Then depression can be due to what we refer to as bipolar disorder. You've heard of bipolar disorder. Bipolar means both bi means two ways. So the person can either be very happy at a time or very sad at a time. That very sad is what we call depression. Do you get now? All right. So bipolar affective disorder can also cause depression. Let's now move on to the drugs that are used to treat depression. Antidepressant drugs. All right, so let's quickly talk about antidepressant drugs. They fall into the following category. Number one, tricyclic antidepressants. They are called tricyclic antidepressants because they actually have three-ring nucleus. So all of them has this three-ring nucleus, and other structures may be attached to this three-ring nucleus. For the fact that they have that three-ring nucleus, that's why they are called tricyclic antidepressants. Three-ring cyclic tricyclic antidepressants, TCA for short. Now, this TCA, how do they work? Let's talk about the mechanism of action, or I think we'll see the mechanism of action later. But let's just talk about it now. For TCA to actually work, what it normally does is this. We have the presynaptic or the presynaptic neuron. Now we have the synapse, then we have the postsynaptic. You get? Now, after epinephrine is being released, norepinephrine, serotonin, they are released within from the pre to the synapse. They have to remain in the synapse for some time to activate the postsynaptic neuron. Now, for some type of reasons, some of those serotonin, epinephrine that are there for some individuals, they will just be going quickly. They'll be going back into the what's now the presynaptic neuron. They don't stay in the synaptic junction for the time they are supposed to stimulate the postsynaptic. Do you get? So for that reason, that's what we refer to as uptake one. They are going back, going back. So TCAs are like drug that you can use to block that uptake one. Once you block them from going back, they will remain in the synaptic junction for a longer time. And therefore the person will be happy for some time because those hormones are the hormones responsible for someone's be to be excited and happy. Hormones like serotonin, dopamine, epinephrine, norepinephrine. You get? All right. So that's how TCA works. So TCA actually prevent or it inhibits what now? Uptake one. That's epinephrine and norepinephrine and serotonin from going back to the preganglionic neuron where they are coming from. So example of this tricyclic antidepressant include amitriptyline, very common, amitriptyline, imipramine. Now once you know these two, you will know many of them. Amitriptyline, then you see that there's one that look like amitriptyline, nortriptyline. So they go together. And when you know imipramine, oh, so interesting. After imipramine, you now see desipramine, clomipramine, trimipramine. So you can see aminophylline, amitriptyline, and imipramine gives it all. Once you know amitriptyline, you know nortriptyline. Once you know imipramine, you know trimipramine, desipramine, clomiramine, then dozepine. That's the last, dozepine. So these are example of antidepressant. That's tricyclic antidepressants. The second group of drugs is called the heterocyclic. Heterocyclic are divided into two. Second generation and third generation. Example of second generation, that's where you have trazodone, bupropion, very common. Bupropion, maproli maprotilene, maprotilene. These are common drugs, but the most common here you majorly see that is bupropion, BUPROPRON. So bupropion is very common. Then for third generation drug, mirtazapine is common. Mirtazapine is common. Then you also see venlafaxine. These are heterocyclic. So you should know the ones that are second generation and the ones that are third generation because they may exchange them in exams. Then we'll now move on to selective serotonin reuptake inhibitors. Selective serotonin reuptake inhibitors. So remember, we said the TCA prevent the uptake of epinephrine, you get, and serotonin. However, there are some that can just inhibit the reuptake of serotonin alone. That's why we call them selective serotonin reuptake inhibitors. An example is where we have fluoxetine. You should know fluoxetine. Fluoxetine is very common. You should know it. Paroxetine. We'll talk about paroxetine when we're talking about drug-drug interaction. Citalopram. You should know citalopram. Sertraline. These are examples of selective serotonin reuptake inhibitors. And the last group is monoamine oxidase inhibitors. Now let's talk about monoamine oxidase inhibitors. Monoamine oxidase inhibitors are drugs that actually inhibit monoamine. Remember, monoamine is a drug, is what actually is an enzyme that monoamine oxidase is an enzyme that actually breaks epinephrine and epinephrine. So when epinephrine is released in the pre and it's supposed to be acting in the post, is in the synaptic junction, monoamine oxidase can be over exaggerated and breaks what's now the epinephrine very fast. So it has no effect in exciting and making the person to be happy. So monoamine oxidase inhibitor can inhibit monoamine oxidase. So they cannot just be breaking things down that easily. It takes some time before it breaks down. And within that time, the person will be excited and happy. Do you get? All right. So example of monoamine oxidase. Some of them are reversible, some of them are irreversible. For example, of monoamine oxidase inhibitors. Some inhibitors are reversible, some are irreversible. You get? All right. So we actually group them into the following category. This is the best way we can group it. There are some that inhibit monoamine oxidase A, because we have monoamine oxidase A, we have monoamine oxidase B. Here, then you have some that inhibit both monoamine oxidase A and B. You get So monoamine oxidase A and B are inhibited by one phenelzine, two isocarbozazid. They inhibit monoamine oxidase A and B. Do you get? So they can inhibit both A and B, and they are the example of irreversible inhibitors. So they should say give example of monoamine oxidase inhibitors that are irreversible. So you say we have one phenazine, two isocarbozazid. All right. Now, when you hear the word hydrazine moiety, it means it is esterified by CNN. Some of them has CNN. So, example, this the CNN moiety is found in this phenazine and isocarbozazid. Do you get? And they are also the non-selective. That means they inhibit both A and B, and they are irreversible. So that's some point to know. So they are non-selective, irreversible monoamine oxidase inhibitors. Let's now talk about the ones that are what now reversible. For the reversible, is what we is under the reversible that we have the one that is non-hydrazine, that it does not have the CNN moiety. And an example of that is where we have tranylcypromine. Tranylcypromine. Tranylcypromine does not have CNN moiety, so it is non-hydrazine, and it is reversible. So it is a reversible inhibitor of monoamine oxidase A and B. You can inhibit monoamine oxidase A and B, but it's reversible. Tranylcypromine. Tranylcypromine. All right. Then for selective monoamine oxidase inhibitor, inhibit only monoamine oxidase A, does not inhibit B. That's why you have moclobemide. Inhibit only monoamine oxidase A. Then the one that inhibit monoamine oxidase B, selective for monoamine oxidase B. That's where you have selegiline. It's not in this slide. Selegiline is an example of that. Hmm? All right, so this is how they actually the antidepressant drug are actually grouped. So remember the four antidepressant groups we just mentioned: tricyclic antidepressant, heterocyclic, selective serotonin reuptake inhibitor, monoamine oxidase inhibitor. If you hear anything like phenazine is an example of what, it's monoamine oxidase inhibitor, irreversible, and has CNN moiety. You hear something like paroxetine, it's an example of selective serotonin reuptake inhibitor. Citalopram, selective serotonin reuptake inhibitor. You have something like imipramine, that is an example of what, TCA. So that's just how it goes. You must know those drugs very well. All right, let's now talk about the pharmacokinetics and the pharmacodynamics of antidepressants. Pharmacokinetics and pharmacodynamics. Let's start with pharmacokinetics. Pharmacokinetics deals with what the body does to drug. So if somebody should take antidepressant, what happens? Somebody should take TCA, first point. TCA is incompletely absorbed. Yes, it's incompletely absorbed, and then it undergo first pass effect. Remember first pass effect? Yes, what the liver does to drugs, breaking them down. So it undergo first pass effect also. Then based on its distribution, it is highly distributed because it is bounded to proteins. Yeah, so it is highly distributed because it is bounded to proteins. Distribution simply means it can move to various parts of the body, yes, because it's protein bounded. Protein are the things that help to transport drugs, specific, majorly albumin. Then if you want to break TCA down, we've talked about its absorption. It's not well, no pharmacokinetic with absorption is not well absorbed. Talk about distribution is distributed because it has high binding ability to proteins. Uh-huh. Then we've talked about want to talk about its metabolism, breaking down. To be breaking down, first of all, remember I said tricyclic antidepressant has three rings, tricyclic. That's why I call it tricyclics. So first thing first, it is the three rings that have been broken down first that are transformed. Then also the aliphatic chain, the side chain that are added are also being transformed. um Pharmacodynamics of antidepressant drugs. Under pharmacodynamics, the important things you just need to know, we already explained most things about the pharmacodynamics, that how they act. We've already seen how they act. Second generation and third generation antidepressant, please remember the names, and then know that we said already selective serotonin reuptake inhibitors inhibits 5-HT uptake. When you see 5-HT, it means we are just talking about serotonin. It prevents serotonin uptake. You get it, blocks the uptake of serotonin. You see monoaminosis they site at. We've already seen how these drugs act. All right, but one important point for you to just remember is this, mm, that when you talk about second generation and third generation antidepressant, they actually act by not only by blocking receptors of what now of serotonin 5-HT2A, 5-HT2C receptor. They block them. All right, 2A and 2C. Okay, this is the most one of the most important points you should know in this material: clinical indications. Clinical indications, like what can you use antidepressant to treat? One, depression. That's why we call them antidepressants. They are used to treat depression. All right, but they can be used to treat other things. For example, panic disorder. Somebody panics a lot. Panic disorder. You can use imipramine and selective serotonin reuptake inhibitor. Remember, imipramine is TCA, and selective serotonin. You must know these ones. Then obsessive compulsive disorder, can use selective serotonin reuptake inhibitor and clomipramine. So clomipramine is also a TCA. All right. Then enuresis, we use TCA. Chronic pain, we use TCA. Somebody who have a feeding disorder where the person has, especially bulimia, the person feels that I don't want to get fat. Person whenever I eat try to vomit, choke his hands so it's try to cause vomiting. That's you can treat with fluoxetine. Fluoxetine. All right. Smoking cessation you can treat with